Hey everyone, welcome back to our channel. In today's video, we are going to talk about Ventolin, a commonly used medication for people with asthma. Ventolin is a medication that is used to treat bronchospasm, which is a condition in which the airways narrow, making it difficult to breathe. The active ingredient in Ventolin is salbutamol, which belongs to a class of medications called bronchodilators. Bronchodilators work by relaxing the muscles in the airways, allowing more air to flow in and out of the lungs. Ventolin is typically used as a rescue medication to quickly relieve symptoms of asthma, such as coughing, wheezing, and shortness of breath. Ventolin is available in two forms, as an inhaler and as a nebulizer solution. The inhaler is the most common form of Ventolin and is available as a metered dose inhaler, which delivers a set amount of medication with each puff. The nebulizer solution, on the other hand, is used with a machine called a nebulizer, which turns the liquid medication into a fine mist that can be inhaled. This form of Ventolin is typically used for people who have difficulty using an inhaler or for those who require a higher dose of medication. If you have been prescribed Ventolin, it is important to use it as directed by your healthcare provider. The usual dose for adults and children over the age of 4 is 1 or 2 puffs of the inhaler every 4 to 6 hours, as needed. If you are using the nebulizer solution, the usual dose is 2.5 mg to 5 mg every 6 to 8 hours. Your healthcare provider will determine the appropriate dose for you based on your age, weight, and the severity of your asthma symptoms. While Ventolin is generally safe and effective for most people, it is important to be aware of the possible side effects. The most common side effects of Ventolin include headache, nervousness, tremor, and increased heart rate. These side effects are usually mild and go away on their own. But if you experience any severe or persistent side effects, you should contact your healthcare provider right away. In addition to side effects, it is important to be aware of the precautions and warnings associated with Ventolin. Ventolin should not be used by people who are allergic to salbutamol or any of the other ingredients in the medication. Ventolin should also be used with caution in people with certain medical conditions, such as heart disease, high blood pressure, or diabetes. If you have any of these conditions, be sure to discuss them with your healthcare provider before using Ventolin. Finally, it is important to remember that Ventolin is not a substitute for long-term control medications for asthma. If you have persistent asthma symptoms, your healthcare provider may recommend other medications to help manage your condition. So that's our video on Ventolin. If you have any questions or comments, please leave them down below. And if you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel.